So with hip pain, there's a few common conditions that we want to talk about. So obviously there are lots of different ways and reasons that you can have hip pain, but we've kind of boiled it down into 5 main areas that we commonly see. And so the first of those 5 is impingement, meaning there's something getting pinched in the hip joint itself. So where the ball goes into the socket, you've got a couple different layers of tissue there that can sometimes get pinched between the neck of the leg bone and the socket where the ball goes into the socket of your hip joint. And so that impingement style pain, we often will get like sharp stabby pains with that when it gets pinched, and is often when we move into extreme ranges of motion. So it's usually when playing a sport or stepping up into something or things like that that we notice that type of pain. So it can be annoying and really limit our ability to participate as fully as we would want to in some of the activities that we love. And then tendinopathy is probably one of the most common, where you get some kind of itis, is usually how it starts. So where a tendon, one of the pieces of the muscle that attach into the bone, those tendons get irritated from being overloaded in some way, shape, or form, whether that's chronically, repeatedly overloaded or just a one-time strain or stress on it. And so that tendinitis or tendinopathy, any kind of tendon injury, that is a really common thing, and that can have some sharp stabby pain at first, but is often more a deep ache that doesn't go away, will often really hurt after an activity, things like that. Sometimes will hurt during, sometimes will warm up during an activity, but usually you pay for it afterwards where that tendon gets really irritated. Another really common one is a bursitis. So underneath some of those tendons where those muscles attach are little pockets of fluid that are meant to help lubricate and kind of cushion one tendon from another, so that a tendon doesn't rub too much on a bone or another tendon. And so those bursitis sacs can sometimes get too much compression on them from the tendons that go over them. And when they get overloaded from our activities too frequently or with too high of an intensity, it can irritate that bursa and cause a bursitis. So it gets inflamed and irritated. And so that's usually one of those things where we want to back off the intensity of the load and keep you moving to keep the fluid flushing through that area, and then we can have that pain go away. So there's a lot we can do with a bursitis. Sometimes that requires other intervention as well. But that bursitis type pain, really usually very point tender. It's a specific spot that's really irritated there. And then arthritis. And all of our joints can get arthritis. The hip is not alone there. Arthritis pain in the hips, deep achy pain. Sometimes you can get periods of sharpness, but it's usually a deeper ache. Nighttime can sometimes be rough. First time you move in the day can be rough. And then weather changes and other things like that. So arthritis, it's one that we actually can do quite a bit about through movement and exercise and building up the strength in that area. But definitely is one that doesn't necessarily go away. That arthritis will still be there, but we can really manage the symptoms and help you get moving again. So there's a lot we can do with that. And then SI joint problems. So the sacroiliac joint, where your spine meets kind of the wings of your pelvis, that sacroiliac joint will often mask or masquerade as hip pain. And so sometimes they're related in kind of how that pain presents itself, or sometimes will be related in how we treat that pain, that the SI joint has a lot to do with all the muscles of the hip. And so we sometimes will treat those things together because they're very related, because most of the muscles that attach into your hip also attach into your pelvis at some point and pull on that SI joint. And so by addressing some of those same things, we can nip that in the bud. So those are the 5 key areas. Like I said, there's lots of other ways and means that hips can be sore or injured, but those are kind of broad strokes, some of the key areas in which we have hip pain. There's also a 6th area that we didn't really talk about through the rest of this video, that we often will see hip pain in, but that's definitely one where you want more medical intervention, where we need to do more than just exercise videos and stuff to help it, and that is with bone stress injuries. So any kind of bony injury in the hip, we definitely want that to be investigated further. And so some of the risk factors for bone stress injuries especially are things like not getting enough calories is actually the number one, and then repeated heavy loads, and where that pain just keeps getting progressively worse and worse. If you suspect a bone stress injury or you've had one in the past, is usually a really high risk factor. Definitely want to make sure you get that evaluated from a health professional. If you're not sure if your symptoms fit that, definitely give us a call. We'd be happy to answer questions you might have about that and help you get to the right health professional so that you can have that investigated.